addition to not only our Georgia delegation, but this body. And I'm proud at this time to yield time to the gentleman from Athens and Augusta and my hometown, Dr. Paul Brown.
Thank you, Dr. Gingrey. I appreciate you yielding me some time. Dr. Gingrey, I have taken a history and physical of Obamacare, and I have looked at all the laboratory results. I've looked at all the X-ray results, and I've got a diagnosis. Obamacare is a destroyer. It's going to destroy jobs in America. In fact, already it's destroying jobs. I've got a lady in my district that right now today has 8 people in her employment. She desperately wants to expand her business. She'd like to hire at least 1 or 2 more people for her small business, but she's not going to do it because of the onerous effect of Obamacare on her business. So it's destroying at least 1 or 2 jobs in that one lady's business. I've got another businessman in my district that wants to make a $31 million expansion of his business. He has the cash in the bank. He doesn't even have to borrow it with all the regulations and all the problems that we're facing with the financial problems that the Frank Dodd bill has placed on banks as well as small business. He wants to make a $31 million expansion of his business, but he's not going to do it because of Obamacare and because of the increased taxes and also the increased burden that this is going to place on him. That's killing hundreds of jobs just in 2 businesses within my district. So it's going to destroy jobs, but it's also going to destroy budgets. It expands Medicaid. In fact, the state of Georgia has a balanced budget amendment to our state constitution. Our General Assembly is just going through the process of trying to balance its budget with a $2 billion shortfall because of the downturn of the economy that was created basically because of policy that was put in place by Democrats. Barney Frank was a big part of that too. But Obamacare expands Medicaid markedly. In fact, the state of Georgia is going to have to add about half again as many people to the Medicaid rolls in Georgia, and the state budget is going to have to pick that up, and it's going to destroy the state of Georgia's budget. And it's going to destroy every state budget in this country. And it's going to destroy our budget. It's certainly not affordable. In fact, we see this administration already, I think it's 1,168 waivers that they've already given to unions and businesses and different entities just because of the onerous financial effects it's going to cause to all those people. And it's going to destroy family budgets. I had a lady tell me about her 26-year-old son recently that his insurance doubled from last year to this because of Obamacare. He's paying for his insurance himself. He's self-employed, and he can't afford it. So it's going to destroy budgets. It's going to destroy family budgets. It's going to destroy state budgets. It's going to destroy the federal budget. Not only is it going to destroy jobs and destroy budgets, but it's also going to destroy the quality of health care. In fact, Dr. Gingrey, we were told, and I'm sure you're going to bring this up, the American people were told by the President, if you like your insurance, you can keep it. Nothing could be further from the truth. The American people need to understand it. The American people need to understand Obamacare was designed to force everybody out of their private insurance into a single-payer, socialized health care system that the President himself said that he wanted just before Obamacare was passed into law. So my diagnosis is it's a destroyer. It's going to destroy jobs. It's going to destroy budgets. It's going to destroy the quality of health care. And also have a plan of action. So I've made the assessment, so we need to have a plan of action. And our plan of action, Dr. Gingrey, is, and the American people need to understand this, it's absolutely critical that we repeal Obamacare and replace that law with something that makes sense, that truly lowers the cost of health care. There have been numerous Republican bills introduced here in the last Congress that would lower the cost of health care. I introduced two that would repeal Obamacare and would replace it with something else. One is a comprehensive bill. I call it the Patient Option Act. It's 106 pages, not almost 3,000. And then I introduced another act that a Democrat colleague told me, Paul, this makes sense more so than Obamacare. It's a good first step. The American people want us to do it in a step-by-step process. It would allow purchases for individuals and businesses across state lines. It would allow anybody in this country to buy insurance through an association. They'd have multiple insurance products at a much lower cost. It would stimulate the states to set up high-risk pools. Several states have already done that. Mississippi, I talked to Governor Haley Barbour about his plan, their high-risk pool that they have in Mississippi has been very successful. Colorado's done the same thing, I understand. And the fourth thing that it would do is it would allow everybody to deduct 100% of their health care cost off the income taxes. That changed the dynamics of health care. So, Dr. Gingrey, I've done that physical examination, history and physical, my subjective, objective assessment, and the plan. The plan is we must, absolutely must repeal Obamacare and replace it with something else. A market-based system that literally lowers the cost of health care and keeps all decisions in the doctor-patient relationship. Obamacare does none of those. It's not affordable for the government, nor individuals or businesses. It's certainly not going to preserve the quality care because it is a destroyer. So I have made that diagnosis, Dr. Gingrey, and I will yield back to you for our further discussion.
Mr. Speaker, I thank the gentleman for his contribution and for being with us this evening. I realize there are conflicting things going on Capitol Hill this evening, very important things, but I really appreciate Dr. Brown being with us, and I know that we have also been joined by another member of the Doctors Caucus. That's our good friend and new member, freshman member from the great state of New York, where my daughter and son-in-law reside. And Anne Marie Burkle is a registered nurse, Mr. Speaker, by profession, and certainly knows of what she speaks in regard to health care, representing the angels of mercy, if you will. And it gives me great pleasure to yield time to Anne Marie Burkle. She is concerned, Mr. Speaker, about the health insurance industry and the complexity of such, and maybe even wants to discuss some ways that we could change and improve. Certainly improvement is called for, and it doesn't have to be within a 2,400-page bill, as Dr. Brown was mentioning Obamacare entails. So at this time, I'm proud to yield to Representative Anne Marie Burkle.
Thank you, and thank you, Mr. Speaker. Mr. Chairman, it's good to be here. I thank the distinguished gentleman, my colleague from Georgia. I am very honored to be here to speak about health care in the United States of America. As was said, I am a registered nurse. I've been a registered nurse for, well, since 1972, a time in our nation's health history where the physician and the patient had a relationship and the government had not injected itself into that relationship. And then after a while I went into law, and for the last 13 years, Mr. Speaker, I have been a healthcare attorney for a large teaching hospital in upstate New York for the last 13 years. And what we did in that hospital, in my role as an assistant attorney general, was we looked at money that was owed to the state of New York. And so I had a very up-close and personal look at the complexity of healthcare in our country today. And I contend that this bill, this piece of legislation that does anything but reform health care, will only increase the complexity of health care in this country. It will only make it more complicated. It will once again put the government right in the middle of the patient-physician relationship. And I contend that's not what the United States of America is about. We need to let the free market play here in our healthcare system. I've spoken in the district to many, many people. I've done all kinds of talks, but there's nothing more up close and personal and of great concern to me as the healthcare system in our country. It is an issue that affects every American in one way, shape, or form. This healthcare bill does not improve the healthcare system in this country. I came to Washington with a wide range of goals as a freshman, as my colleague has mentioned, but nothing more important to me than repealing this health care bill, this 2,000-plus page bill that does anything but reform health care. It adds to the complexity of an already complex system. It puts the government in places where it shouldn't be. It doesn't protect that patient-physician relationship. Last week when I was in the district, I had my very first Health Care Advisory Council meeting, and I spoke with a group of physicians, a group of health care providers, hospital administrators, and we had a conversation. And I said to them, what are your concerns as health care providers? You're on the front line. What can we do down in Washington to make health care, the delivery system better, the delivery system more affordable? And they looked at me, and interestingly enough, all of the people on the front lines came up with different solutions because, as you can imagine, doctors and healthcare providers are good at diagnosing. The question is now about the solution. What are we going to do for healthcare in this country? And we're here tonight to say this bill is the wrong bill for this country, but we're not willing to leave it go at that. We understand that true healthcare reform will include medical malpractice reform. We need tort reform in this country. We need to increase the use of health savings accounts. We need to make insurance portable so that we can buy it across, so we can, when a person loses their job, they don't necessarily lose their health care coverage. We need to allow for the purchase of health care across state lines. We need to put the patient back in the center of health care. And I contend that this health care bill does not do that. So as we sat around, and I said to my group of health care advisors, and I said to them, what is it that concerns you most regarding health care in this country? And the first thing was our health care, this health care bill that was just passed. And when you get into why does it concern you, because it adds so many layers of bureaucracy and regulations to an already laden bureaucracy and already an industry and system that's laden with regulations. If you talk to a health hospital or a physician, the regulations and the impediments they have to access that patient for health care is incredible. And so the concern with this bill is it adds so many more layers. It takes this health care bill, and one of the biggest problems with this health care bill is that it takes a piece of legislation and it hands it off to the regulators. And then with the regulators, they're left to interpret and to deal with and come up with regulations that affect our health care providers. Beyond that, they recognize the need for tort reform. We need medical malpractice liability reform. If we're going to talk about reducing the cost of health care, we must consider that. And then they talked about the increased regulations on the health care profession. What we all agreed upon in that meeting was that the health care in this country it's a good health care system. We have good health care. The quality of health care is not the issue. The issue is the system of health care. And this bill that was passed in 2010 does nothing to make that health care system better. It only complicates it. It only ladens it with more regulations and once again puts the government back in between the physician and the patient relationship. I thank my colleague who has an esteemed history of being a medical provider in the healthcare industry, and he understands these issues. He understands what good healthcare and what a good healthcare system would look like. So I commend him and I thank him for this opportunity to speak. I think that what we need to do here in Washington is to repeal this health care bill. And we need to put our heads together collectively and talk to the professionals, talk to the health care providers, talk to the patients, and get together and come up with a systemic plan that will reduce the cost of health care, help to improve access to health care, and not affect the quality of the wonderful health care the United States of America offers. In my years in the Attorney General's office as representing a large teaching hospital, I know how many people wanted to come to this country for health care. I know people from Canada and from Europe because they knew they had access to good quality care. They knew they wouldn't have a 6 or a 9-month wait. I think with this system, if we allow it to go on, this health care bill, we will see those 6 and those 9 months wait while the patients are waiting for the government to make a decision about their health care access. So we need to repeal this bill, and we need to enact true health care reform so that we can improve access, we can reduce the cost of health care, and we can maintain the fine quality of health care in this system. Thank you to my colleague, and I yield back.
Mr. Speaker, I thank the gentlewoman from New York for sharing her thoughts, and certainly I agree completely with her, and she clearly knows of what she speaks. This law, it's no longer a bill, it is now the law. Patient Protection Affordable Care Act. It's been the law for a little bit more than a year, as I said earlier. And of course, the Congressional Budget Office that estimates the cost of laws that we put into effect, they give us an estimate when it's in the bill form, so members can decide whether or not what we're about to do is something that is affordable. And the estimate of this law costing $900 billion, Mr. Speaker, the true cost over the next 20 years is probably in the neighborhood of $3 trillion, not $900 billion. But I do want to just talk about that number and remind my colleagues about the pay-for provision that the Democratic Party, the former majority party in the 111th Congress, had in place at the time that this bill was passed. Everything had to be paid for. So you had to figure out a way to come up with the money. And in passing this bill and paying for it, Mr. Speaker, some $570 billion was taken out of the current Medicare program. The Medicare program, which serves something like 47 million of our seniors, 5 or 6 million of them are younger people who are on disability that are covered under Medicare. And we literally, to help pay for this new entitlement has very little to do with Medicare, except that half of the money, half of the pay-for in this $900 billion was taken from a program, Medicare, servicing our disabled and our elderly, providing them health care. Half of the money was taken out of that system, and the actuarians and the Medicare trustees tell us that over the next 75 years, the unfunded liability, Mr. Speaker, of Medicare is something like $35 trillion with a T, $35 trillion. And yet we took the money by cutting Medicare Advantage, something like $120 billion. We cut money out of hospice. We cut money out of long-term care, skilled nursing homes. We cut money out of home health care. We taxed everything that even looked like it had anything to do with health care, durable medical equipment, supplying oxygen for people that were and are continuing to struggle from chronic obstructive pulmonary disease, emphysema. is a term that we used a lot, and I think most people would recognize that. But, I mean, finally to come up and say, okay, we paid for this. But at the same time, Mr. Speaker, we did absolutely nothing in regard to medical liability reform, something that probably, if there was something in this bill, Obamacare, as the President did promise that there would be, could save $200 billion a year, according to the RAND Corporation and other think tanks, from the overall cost of health care, this 1/6 of our entire economy, gross domestic product in a year. That's how big this industry is. So nothing, essentially nothing in the bill about medical liability reform. Why do I say that, Mr. Speaker? My colleagues, I think you understand that it's not about the high insurance premiums that doctors have to pay on an annual basis so that they can practice and be protected from liability if something goes wrong. Obviously, they need that protection, and those health insurance premiums for the high-risk specialties like the one that I enjoyed for 26 years, OBGYN, neurosurgery. Mr. Speaker, think about that doctor at the Tucson Medical Center that was there in that emergency room when our colleague, Representative Gabrielle Giffords, was taken there literally near death. And I think Dr. Rhee was his name, R-H-E-E. In fact, Dr. Rhee, I learned later, was a graduate of the great school that I went to, Georgia Tech, Georgia Institute of Technology. But Dr. Rhee spent his career after completing medical school in the military, served his country for something like 22, 23 years, and he happened to be in that emergency room as head of the trauma center with all that specialty training and all those years of treating our wounded warriors in many conflicts, I'm sure Afghanistan and Iraq. Mr. Speaker, if he had not been there, our colleague Gabrielle Giffords, God bless her, we would be talking about her today as we were talking earlier about John Adler, our former colleague who died today from a great state of New Jersey. But that doctor was there. He was there. And I fear, as I talk about this new health care law, there's hardly any provision in there that would provide for doctors, even primary care physicians. There's some attempt, but when you take all the additional Medicaid eligible patients, increasing the minimal eligibility at 138% of the federal poverty level, you add just millions of additional patients to be seen, and literally hundreds of billions of dollars of additional cost on the backs of our states that have to have a balanced budget, unlike here in the federal government, where we just keep borrowing money and we're now at up to $14 trillion worth of debt. So we have a huge problem in regard to this law that the CBO says costs $900 billion over 10 years. I say, and this poster points it out, true cost, the last bullet point with the red dot, $2.2 trillion and counting. But as Ms. Pelosi said, and I quote her in the third bullet point here, we have to pass the bill to find out what's in it. And that was before the bill passed, and clearly we're finding out now, unfortunately, what the true cost is. Mr. Speaker, I want to yield additional time to my colleague from New York, and I yield to the gentlewoman.
Thank you, and thank you, Mr. Speaker. My colleague just brought up the cost of this health care bill, and I think it's interesting to talk about and insert what I have heard from the healthcare community throughout the course of this discussion. For many hospitals who have a high level of indigent patients, there is what was called a disproportionate share of money that was paid to those hospitals to help them offset the cost of treating folks who are on Medicaid and who are not able to afford their own health care coverage. This health care bill removes the disproportionate share. It phases out that payment to hospitals so that they can afford to treat indigent patients who cannot afford health care. I think that's a very significant piece of this bill and this law that was not discussed, and how it will impact and how it will hurt hospitals. I think beyond that, we need to talk about seniors and the choices that this health care bill takes away from seniors. Again, that wasn't discussed. The Medicare Advantage programs and all of the disadvantages that this bill will cause to seniors. We need to keep our health care system intact so those who need the system, such as the seniors, have access to good health care and their coverage is not hurt. This bill does hurt senior coverage. I yield back.
Mr. Speaker, the gentlewoman is absolutely right, and as I pointed out in that $500+ billion cut out of the Medicare program to help pay for this new entitlement, Patient Protection Affordable Care Act, $120 billion of the 500+ was taken from the Medicare Advantage program. The Medicare Advantage program enrolls about 20 to 25% of our Medicare beneficiaries. Why so many? We're talking about maybe 11 or 12 million sign up and decide that rather than the traditional fee-for-service and just pick a doctor out of the yellow pages that accepts Medicare, it's more like a health maintenance organization that emphasizes wellness. It emphasizes prevention, tests that are not typically covered under traditional fee-for-service Medicare, like colon cancer screening, breast cancer screening, mammograms for women, especially between the ages of 40 and 60, prostate cancer screening for men, annual physical examinations, follow-up from a nurse practitioner within the doctor's office, maybe even on a monthly basis to make sure that the senior is taking the medication that was prescribed by the primary care doctor. All of these things are included with Medicare Advantage. That's why it's called Medicare Advantage. It is an advantage with very little additional cost. In fact, people that, Mr. Speaker, that are under those programs don't have to buy supplemental, typically don't have to buy supplemental insurance to cover co-pays and deductibles and hospital care after you've exhausted your benefit. So that's why so many choose that. And yet what we've done is we've gutted that program so badly that those 12 million, it's estimated that 7 million of them will lose that coverage under Medicare Advantage. So they'll have to get it under traditional Medicare, and they'll have to pay $130 a month extra for that supplemental, whether they get it through a plan that's endorsed by the American Association of Retired Persons or some health insurance company, but the average cost is going to be an additional $130 a month for those folks. So as we talk about the cost, I do want to shift, Mr. Speaker, to the cost to employers. In this next slide, where the title says, Obamacare hurts workers, increased costs, majority of employers anticipate health care reform will increase health costs. And most say they plan to pass the increases onto their employers. 88% plan to do that. Or reduce health benefits and programs, 74%. This idea of setting up these exchanges throughout the 50 states and territories, and that only 6 million people who have employer-provided health insurance can keep it. They won't need to be on the exchanges. Mr. Speaker, that is absolute poppycock. It's probably going to end up being about 130 million people who get their health care provided today by their employer will end up in those exchanges. And that's why I say this cost that was estimated by the CBO of $900 billion will be in the trillions, because when all of these people morph out of employer-provided health care onto these exchanges, think how many of them will be eligible for a federal subsidy to help them pay for that insurance. Because the law says, the so-called Affordable Care Act, that anybody with an income of less than 400%, not 100%, not 200%, not 400% of the federal poverty level, which is getting close to $90,000 for a family of 4. I think of my 4 children and their families of 2 and 3 and 4, and I know what their incomes are. You know, the federal government will be subsidizing so many people that the cost, the true cost, will be astronomical, and it's something that we cannot afford. And that's why our representative from New York and our other representative from Georgia spoke earlier about we can't do this. We can't afford to do this. We need to repeal this law. It's a bad law. I've said before, Mr. Speaker, that in my humble opinion, I think it's the worst law that's ever been passed in this Congress. There have been some folks on the other side of the aisle, well, not on the other side of the aisle, but the more liberal media who took me to task for saying that, but I truly believe it. I truly believe it's one of the worst laws that we've ever passed, and we have made every effort to repeal it. One of the first things we did in the 112th Congress was pass H.R. 2 to repeal Obamacare. We sent it over to the Senate, and the Senate, which is controlled by the Democratic majority and led by the senator from Nevada, Harry Reid, just simply, I guess, put that in file 13, and H.R. 2 is sort of dead in the water over on the Senate side. So what we're doing now, it is our obligation, because what the American people have told us, over 60% of them, here a year after passage of the bill, despite the fact that Ms. Pelosi said, once we pass it and you find out what's in it, you'll like it. No, they don't. They don't like it. Don't like it one darn bit better. And they wanted us to repeal. We made every effort at repeal. And now we're into Plan B, Mr. Speaker. Plan B, of course, is to try to defund especially the parts of the bill that are on automatic pilot, that we have no control over. And I say we, I don't mean the new Republican majority in the House of Representatives. I mean every member of Congress, 100 senators, 435 members of the House, both sides of the aisle. For goodness sakes, we ought to have control over the spending. Let me just, this is not a poster. I don't have a poster on this one, but tomorrow, in the Energy and Commerce Committee, Mr. Speaker, the committee on which I am proud to serve, along with several of our other House GOP doctor members, we are going to have a markup on several bills to change this automatic pilot spending under Obamacare and put it into the more typical discretionary spending, where members of Congress can say, we want to spend that money, and if we do want to spend the money, how much do we want to spend, and that we have oversight and we can make sure every year that we look at the program and if it's not working, then defund it. In these bills, and I'll just mention them real quickly, H.R. 1217, a bill to repeal the Prevention and Public Health Fund, $17.5 billion that the Secretary of Health and Human Services has control over, a fund of money that she can spend in any way she wants to. You think back to the ads that we saw Andy Griffith as the pitch man on television last year about the great value of this new law and how it's going to strengthen and improve Medicare. How you do that by cutting $500 billion out of a program is beyond me. But that money, that $17.5 billion in this Prevention and Public Health Fund, can be spent indiscriminately by a decision made by whoever the Secretary of Health and Human Services might be. H.R. 1216, H.R. 1215, H.R. 1214, H.R. 1213. In the aggregate, this is over $18 billion worth of spending that we members of Congress have no control over. We're going to get control over it, though, and we're going to defund anywhere we feel that it is wasted, duplicative spending that the American people can ill afford. I want to go ahead and point out a few other things that are on these slides, Mr. Speaker. I mentioned, of course, the $575 billion cuts from the Medicare program. I mentioned the 7.4 million people who will lose their coverage under Medicare Advantage because of that $126 billion pay-for. I didn't mention, though, on this slide, the third bullet point. Many physicians may stop taking Medicare patients because reimbursements will be below the cost of providing the care. Now, is that Representative Phil Gingrey from the 11th of Georgia? Is that a statement that I've made? Well, maybe I have made it, but I'm quoting the actuary of Medicare, Richard Foster, who we had last week as a witness before the Energy and Commerce Committee, talking about some of these things. This bears repeating, Mr. Speaker. Many physicians may stop taking Medicare patients because reimbursements will be below the cost of providing the care. Richard Foster, Committee on Medicare and Medicaid Services, Chief Actuary. Today, doctors are reimbursed under the Medicare program by a formula, an arcane, very difficult, you talk about calculus being difficult, understanding the sustainable growth rate formula to determine how doctors are reimbursed for providing their service, whether it's their brain power or their surgical skills, is beyond anybody's comprehension. And every year for the last 6 or 7 years, when you apply that formula to the next year's reimbursement level, there's a cut from the last year's reimbursement, 2%, 3%, 4%, to the point now, Mr. Speaker, what we've done, of course, we here in the Congress have mitigated those cuts and said we're not going to enact those cuts because these doctors will not be able to provide the care, just as Mr. Foster, the actuary, said. And if we don't put a Band-Aid on these cuts and mitigate them, then the doctors will just drop out of the program, and I don't care how much you expand access and hand out more insurance cards. If there are no doctors there to see you, you're not going to have care. You do not have decent care. You don't have any care. So in this bill, in this new law, not only is that formula still there, and the doctors facing a 31% cut in their reimbursement if we don't mitigate it once again come December the 31st of this year, not only is that on their backs, but in Obamacare, there's this new provision called IPAD, this new bureaucracy, Independent Payment Advisory Board, that's going to actually cut the doctors even more. We're not going to have, the actuary is right, we're not going to have doctors providing the care. And that's because we've taken money out of this program and put it into an entirely new entitlement program, for the most part, for young people. Some entitlement, when you force them to buy health insurance, in many instances when they don't need it and they don't want it. Mr. Speaker, I see we've been joined by the co-chairman, along with myself, the co-chairman of the House GOP Doctors Caucus, my classmate from the 108th Congress, member from Pennsylvania, my friend and colleague, Dr. Tim Murphy. And I yield to Dr. Murphy.
I thank you for yielding, Dr. Gingrey. You know, all of us in the Doctors Caucus are people who have treated patients, and we know full well the value of quality health care. And we also know what happens when bureaucracy gets between the patient and the doctor, and you find yourself spending as much time worried about paperwork and forms and what the government is going to do than sometimes you're dealing with your patient. That's not good health care, and that certainly isn't good health care reform. All of us who are health care professionals know that the treatment should not be more harmful than the illness itself. And what happens with the health care bill that was passed, when you look at some of the parts of this and realize what it does to the patient, to taxes, to employers, to hospitals, to community health centers, to the cost of drugs, you have to conclude that we did not fix the problem, we financed the problem, and it is growing and growing, and that's not the right direction. Let me give you a couple of examples. This bill, this act, actually creates about 1,900 plus new duties and responsibilities for the Secretary of Health. It has 100 or more boards, panels, and commissions of people that we don't yet know who they are to write regulations that we don't yet know what they are. We also know that despite the words about the goal, the actual means to get there and what happens isn't what is purported to be doing. Let's look at, for example, we keep hearing about 35 million Americans will be covered. And yet, we also hear from various consulting firms that it won't be 9 million Americans that will lose their health insurance. It may be tens of millions of people who will lose their private insurance. So covering 35 million, but perhaps the same or double that, losing their insurance, doesn't get us to where we need to be. We also heard that health care costs were going to go down. I had someone from HHS from Philadelphia come to my office and told me with a smile that wasn't it great that health care costs were only going up 2 or 3%. I asked this person if they bothered to talk to some of the employers in the state of Pennsylvania, because a lot of them told me their health care costs are going up 20 and 30 and 40%. I asked if they had talked to some of the families whose children were covered on plans before that exclusively covered children, to find out that those plans were not going to cover children anymore because of the way that government decided to design those. Our goal should be to treat. Our goal should be to help. Our goal should not be to stop at just rhetoric and say we have good intentions and therefore we have good outcomes. But good intentions don't make good outcomes. Where we could be spending money is on some real reforms. One of the issues that we've been united on has been to help community health centers. One community health center in Pittsburgh that I visited with the Squirrel Hill Health Center treats about 700,000 individuals through more than 2.3 million visits annually. Throughout these community health centers in Pennsylvania, there's 45 in 67 counties, 60% urban and 40% rural. Their patient base is 68% Medicaid, uninsured, and uninsured, and 93% of patients have incomes at or below the 200% of the federal poverty level. What is interesting is how much lower they can provide, how much lower in cost those clinics throughout Pennsylvania and, quite frankly, throughout the nation can provide high-quality health care. But what we've created is a couple burdens. You know, I found it interesting as part of the health care bill, one of the things we passed was an amendment that Congressman Gene Green, a Democrat from Texas, and I had authored to allow doctors to volunteer at community health centers. If Dr. Gingrey wanted to go to a community health center and volunteer, if I wanted to, or any of the other ones, you know what, we couldn't do it. And the reason being that those community health centers say, we can't afford to have you volunteer. Because in order to volunteer, they'd have to pay the medical malpractice costs. Instead of having them on the Federal Tort Claims Act, employees of those clinics can do that. And that adds to their costs. In the meantime, those clinics are short 10, 15, 20% of what they need in providers. They are a tried and true method of bringing together people from a wide range of disciplines, from OBGYNs, family practitioners, dentists, podiatrists, social workers, psychologists to work. That's one of many things we could be doing. But along those lines,
Dr. Murphy?
There's a great many things we can be doing. Dr. Gingrey, I'll yield to you.
If you could wrap up, and I want to thank you, Dr. Murphy, and I appreciate you Mr. Speaker, thank you for the time. I know our time is up, and yield back. I just refer to our last post in conclusion, repeal and replace Obamacare, and I yield back.
Yep, thank you. Under the Speaker's announced policy of January 5, 2011, the gentlewoman from the Virgin Islands, Ms. Christensen, is recognized for 60 minutes as the designee of the Minority Leader.
Thank you, Mr. Speaker. And I just wanted to start off by saying, in response to some of what I've just listened to, and I'm not going to take it point by point, I just want to point out that what we passed last year is not Obamacare. To the people of this country, it is your care. And if you allow it to be repealed, defunded, or picked apart piece by piece, President Obama will still have his health care insurance, and so will many of the people who are trying to take away yours, your care. Just remember that the Patient Protection and Affordable Care Act was not to provide care for us. It was to provide care and access to quality, affordable health care for you. It's not Obamacare. It's your care. Do you want to go down? At this time, I'd like to yield to my colleague from Maryland, Congresswoman Donna Edwards.
I'd like to thank Congresswoman Christensen for the time, and just a reminder that today, April 4th, is a sad remembrance in some ways of the assassination of Dr. Martin Luther King, Jr. in Memphis, Tennessee, some 43 years ago. It's such an irony that we're here this evening at this time, because there are so many things for which Dr. King fought and struggled that are ever present today, both in our policy, in our politics, and in our national culture and through our social fabric. During this year also, we commemorate the 40th anniversary of the Congressional Black Caucus. It's important for us to remember that the Congressional Black Caucus was founded to tackle the injustices that Dr. King pointed to and to promote equity in the United States and with and through our United States political process. Dr. King dedicated his life to the then uncomfortable conversations on injustice faced by African Americans across the country. Dr. King knew that tackling discrimination in the United States could not only focus on knocking down social barriers, but also economic barriers that held African American workers, held low-wage workers from economic wealth to sustain their families. I want to thank Dr. Christensen and so many of my other colleagues who've joined me in the introduction of House Resolution 198, recognizing the coordinated struggle of workers during the 1968 Memphis sanitation workers strike to voice their grievances and reach a collective agreement for rights in the workplace. What an irony here in 2011 that the battles that Dr. King, for which Dr. King fought so valiantly, are today's battles. The House Resolution 198 has among it today 55 co-sponsors. We recognize that we may not be able to move this measure to the floor, but it's an important remembrance, commemoration of the struggle of those sanitation workers, those city workers, those municipal workers as they tried to organize. As Dr. King knew, organized labor is a cornerstone of our democracy, and the organizations of organized labor have altered many facets of our nation. They've changed our nation for the better. Organized workers will forever change the labor debate in Memphis through their collective will. That's what happened in Memphis on those days 43 years ago. Just 2 weeks ago, we recognized the 100-year anniversary of the deadly Triangle Shirtwaist factory fire, which ushered in improved safety standards for workers. And decades later, the deaths of 2 sanitation workers in Memphis resulted in a movement to grant workers in Memphis, Tennessee, the basic rights in a workplace. Dr. King believed that the struggle in Memphis for workers' rights was akin to the civil rights movement. It was a partner to the civil rights movement. The motto of the sanitation workers' strike was, "I am a man," signifying the demeaning way in which African-American men had been treated and referred to as boys. I am a man. What powerful words, urging the city to grant them the full rights to equality and justice guaranteed under the principles of our nation. And Dr. King stood in solidarity with the strikers in the fight for justice and the basic human rights for all men and women in the workplace and in society. Indeed, there are many of us in this Congress who stand in solidarity with the strikers and workers across this country, municipal workers, private sector workers, public sector workers who are fighting every day for justice in their workplaces. Indeed, 43 years ago is the struggle of today. And thanks very much to the legacy of those strikers in Memphis and to Dr. King, we actually live in a nation where workers all over the United States can indeed demand justice and fair working conditions. These basic rights allow men and women to pursue economic wealth and pursue the American dream. But in recent days, we face a virtual assault on basic workers' rights, things that we have known for generations in this country. And even though those events are unfolding in Wisconsin, the outcome of whether unions have the right to collective bargaining in that state will affect union members across this country. Indeed, that was the fight and the struggle for justice of sanitation workers. I want to refer to Dr. King's speech in Memphis at a rally on behalf of sanitation workers. He said, quote, "We've got to give ourselves to this struggle until the end. Nothing would be more tragic than to stop at this point in Memphis. We've got to see it through. We face the same challenge today. We have to push through in states like Wisconsin and Indiana and Ohio and across this country to help public employees and indeed all employees fight against the injustices that they face in their workplace." In Dr. King's last speech, he highlighted the perils at which he sought equality and justice for all men and women. In his words, I quote, "I may not get there with you, but I want you to know tonight that we as a people will get to the promised land." And for workers, what is that promised land? It is the promised land of a workplace that's safe. It is the promised land in which one makes wages that allows one to take care of one's family and contribute to the community. It is a workplace that actually respects workers as partners in the success of a company and a workplace. Dr. King at this time, when he addressed workers in Memphis, had already faced threats against his life, including a stab wound that he had suffered at a book signing in New York City, in New York. In his speech, Dr. King recalled the doctors saying that he had sneezed following the attack, that had he sneezed following the attack, he would have died, but noted he was glad that he did not, or else he would have missed the progress in the civil rights movement. Today is a day of remembrance for so many of us. On the point of injustice, Dr. King said so poignantly The issue is injustice. The issue is the refusal of Memphis to be fair and honest in its dealings with its public servants, who happen to be sanitation workers. Now we've got to keep attention on that. And just as he reminded us 43 years ago, we have to keep the attention on our workers who struggle every day. Dr. King was determined to be in Memphis with those workers. And let's think about where we are here 43 years from that fated day in April. Our country is moving out of recession. We continue to stand with workers and stand with job creation, some of us do, to reverse the effects of the recession on our most vulnerable communities and to empower all Americans, empower workers. The unemployment rate among the African American population remains far too high at 16.6% in March of this year. Now, the overall unemployment rate has fallen. We're grateful for that, but I think were Dr. King alive today, he would probably acknowledge the struggle of those who are working and those who want to work, the many who are chronically unemployed in their communities across this country. The unemployment rate among African American men was 20.2% in March of this year, just last month. The unemployment rate among African American women was 11.7% in March. Put these numbers up against national numbers of unemployment at 8.8%. And while those numbers, again, thanks to the brilliant efforts of the President of the United States, of the Democrats in Congress during the 111th Congress, who actually brought us to a point where we put in some policies that could bring down the unemployment rate, those numbers are still troubling among minority groups. But I will say, Mr. Speaker, that one of the challenges that we have is that in this country where workers struggle every day, we look at stagnant wages that have really crippled the American workforce, the public sector workforce, the private sector workforce in this country, that we still have a lot to do when it comes to creating jobs. And yet here we are again this week, and I don't know what day we're on, 89 days, not having created any jobs to address those very concerns that Dr. King had just 43 years ago. And just a reminder to us all that according to Dr. King, he said so profoundly about the American labor movement, and I quote again Dr. King, and I wish that I could do it with his eloquence, but I think it's important for us to be reminded of his words. The labor movement was the principal force that transformed misery and despair into hope and progress. Out of its bold struggles, economic and social reform gave birth to unemployment insurance, old age pensions, government relief for the destitute, and above all, new wage levels that meant not mere survival, but a tolerable life. He continued, the captains of industry did not lead this transformation. They resisted it until they were overcome. When in the 30s the wave of union organization crested over the nation, it carried into secure shores not only itself, but the whole society. Dr. King recognized so profoundly the connection between the struggle of workers, the struggle of the sanitation workers in Memphis, to the struggles of the American labor movement, and in fact to its foundation. And with that, I recognize that my colleague from New York, Paul Tonko, has joined us on the floor, and perhaps he'd care to join in this discussion.
Well, thank you, Representative Edwards, for bringing us together this evening on what I think is a very timely discussion. You know, it seems as though 43-year-old history resonates profoundly today. The same battles for which Martin Luther King had fought, the eloquence with which he raised America's consciousness is needed today, not only in the halls of government, but across America, to understand that there's an attack, I believe, on workers. There's a diminution of the impact of our middle class, our working families in this country. When we look at the fact that the top 10% of Americans now own or earn around 50% of our national income. You know, we look at stats from 1950 that had the executive salaries somewhere in a 30-to-1 ratio compared to the American worker. By the year 2000, that had changed drastically. It's some 300 to 500 to 1. So it's obvious that the gap between those who are drawing large paychecks and the workers, the masses that make things work, that have the need to have purchasing power so as to enable our economy to function and function well, have been threatened. They've been at risk. And I think that, you know, the whole moral fabric that Martin Luther King embraced, the entire mission to raise America's people as one by providing for the dignity of American workers, was a tremendously strong statement in defense of all people, not just people of color, people of every demographic, people of every racial persuasion that could provide for a stronger America. And it was that vision that he had, and he shared it so eloquently. And his climb to the mountaintop was bringing all of America's children and people along. He knew that the empowerment of the individual meant the empowerment of society. And as we weave the strands of diversity into the fabric of America, our mosaic growing stronger and brighter and more vibrant enables us to be a nation that really, truly is unique. If we could just empower the American worker. I see the raid now on the middle class in these chambers, in the congressional chambers, both the House and the Senate, being so focused on a dismantling of the power of the working families, of the true middle class of our society. That is a wrong move. That is one that will devastate our economy, and one that is not utilizing, embracing the intellectual capacity of this great nation. Cuts to our children through Head Start or in classroom experience is the worst cut of any, because it's our future that we're playing with. We're not allowing for the dignity, again, of which Martin Luther King spoke, to be felt in the classroom, and that magic of learning is dulled. It's dulled by these painful cuts. So we have got to respond with compassion and with our eyes wide open, knowing that that message of 43 years ago and that powerful statement made about the dignity of labor the evening before he was brought down still speaks to every one of us, or at least ought to, so that we can provide for the sorts of policy and the resource advocacy, the distribution of income across this country in a way that really empowers the individual and families. That, I think, is the mission that is still there for each and every one of us. So many of us were inspired by the words of John F. Kennedy, Martin Luther King, Robert F. Kennedy. It drew people to the public arena. They wanted to be involved. They saw government as a noble mission. And that tarnished atmosphere that's prevailing today has allowed for misrepresentation of facts or denial of data that really should guide our process here, as Martin often called for fairness, for equitable treatment, for justice. Those are the factors that drive the dignity. And so it is a challenge to us, but I think we're up for that challenge, and I remain optimistic. If we just provide the boost to our nation's working families, to our middle class, then we are all empowered. I think that tide would lift all boats. So thank you, Representative Edwards, for bringing us together on a very important discussion.
I'd like to yield to my colleague, Donna Christensen.
Thank you, and I'd like to thank both of you for